the views, opinions, or facts expressed by the panelists on this television program. Please consult your doctor.
Good evening. The last time we were here live on this program was March the 12th. That was a little bit more than 3 months ago, and it was right before all the precautions for COVID-19 were put into place. Today is June 25th. The year is 2020, and it's been a doozy, and we're only halfway through. We are having a show this evening to let you know that even though COVID is front of mind, and it should be, that there are many people who still need medical procedures that are waiting that should not be waiting. There are emergencies out there that you do need to take care of, even though we are in the time of COVID. The question is going to a hospital safe? And that's why we are here tonight. We're here to talk to you about what that process is and if it is safe. The title of the program is Don't Delay Care, Emergencies Cannot Wait. If you feel like you're having a heart attack, call 911, get to the hospital. If you feel like you're having a stroke or someone around you is having a stroke, call 911 and get to the hospital. These things are very important because timing in certain situations is the game. It is what needs to be done. That's why we're here tonight. Obviously, we're all wearing masks. We're going to talk quite a bit about everything that's going on in the news today, the spikes that are happening in our country. So that is not lost on the medical community. But at the same time, we want to make sure that people who need the care are going to get the care. Hospital and emergency care units have all the right precautions in place. And yes, it is safe to get the care that you need. You may still have questions. I still have questions, and that's why we're here this evening. This is a live program, so think of some questions of your own that you want to call and ask us about tonight. The number is 881-0013. We've got some great medical students here from Texas Tech Paulo Foster School of Medicine, and they are going to be sending the questions our way. We have Prakash Thomas with us and also Jonathan Espinosa, and they're going to be texting me the questions, so that's something new tonight. We're trying to do everything non-touch, but by all means, give them a call because I know there's a lot of questions out there. This evening's program is underwritten by Tenet, the Hospitals of Providence, and we also want to thank the Texas Tech Paulo Foster School of Medicine again for bringing in our students to help us out. Good evening, I'm Catherine Berg, and you're watching the El Paso Physician. Thanks again for joining us. Again, the last time we did a show live was on March 12th, and there were a lot of things that we didn't know yet. There is a virus on the run around the world, and at that time we were talking about just COVID-19 and what was going on with that. We're 3.5 months into this virus, and we're looking at the time. Those of you that watch the show a lot, at the time we were saying don't go directly to the emergency rooms. I'm sorry, my mask keeps slipping, my apologies, but I'll keep pulling it up. Don't go to the emergency room, instead go to your doctor's office, and or if there was a telephone number at the time that was 211, that's still the idea if you are a person who thinks you may have some symptoms of COVID-19. That has not changed. What has changed, however, is the idea that going to the hospital anytime is going to put you in harm's way or put anybody else in harm's way. The emergency rooms are ready for people who are having other emergencies that are not related to COVID. That's why we're here this evening. We have two emergency docs with us here. We have Dr. Baruman, who is emergency medicine. That's you. Sorry, you guys switched places. And then we have Dr. Lansky, who is pediatric emergency medicine. And with that, I'm going to ask both to explain what your roles now are. You're emergency medicine, but obviously the last several months, you did emergency medicine one way before, and that was didn't seem like there was a lot things changing or different. Now there's a lot of things that are a little bit different. So talk to our audience about what you do all day, every day in the time of COVID in the emergency room.
So I think for the most part, we're still performing the same medicine, just with a lot more precautions. Mm-hmm. Everybody has PPE on. Everybody's very much aware of what the disease process should look like and what the obvious signs of them are. But we also know that there are a lot of asymptomatic carriers. So we try to be very, very careful with every single patient that comes in, treating essentially everybody as if they were COVID positive until we know otherwise. And those that we have a higher suspicion, we call persons under investigation, and those are treated with extra kit gloves.
Okay, nicely explained. And Dr., is it Lansky? Yes, Lansky. Yes, Dr. Lansky. So you're pediatric emergency medicine. And that's going to be something that we're going to talk a lot about tonight too, because now we're looking at parents and my child. Should I take my child and put me at risk and my children at risk? And maybe the risk is not the right word, but how are things changed for you over the last several months?
So certainly, as Dr. Berman already mentioned, we're still practicing medicine the way we did. We're doing it, though, with all these extra precautions. And before the virus actually hit El Paso, we did spend time with the hospital, different units and administration, looking at how we need to handle this situation that we knew was coming up, both with patients and families coming into the hospital, as well as flow of what would happen if we were in a situation where we were overwhelmed with patients.
Right.
And we're not seeing that at this point, which is a very good thing. But we do want to press the point that we're taking all the precautions, both as you enter and while you're in the emergency department, to make it as safe a place as possible so we can care for people that are in need.
Exactly. Nicely explained. And I wanted to talk to our audience this evening. Again, I'm going to be touching my mask, even though it's just one of those that keeps crawling. It's the first time I've worn it. I thought it'd be fancy for TV. But the reason we're wearing our masks, we are 6 feet apart from each other, but we are speaking loudly. And that's one of those situations too. A lot of what we are finding in research is, yes, surfaces, but speaking loudly, and the mask, that's why it's important. So I'd like to get that into our show here and there. We chose tonight, as we came into the studio, to wear the mask. Originally, we thought we wouldn't have to. But at the same time, looking at the space, we thought, you know what, if we were maybe 4 or 5 feet more apart, it would be different. So saying that, I am just telling the people at home, we're here as an information show, that anytime you have a chance to be outside or be in the public, definitely wear the mask for your safety, fine, but also of everyone that's around you, for their safety, because you were talking about asymptomatic, and I'd like to go to that really quick too. If Dr. Bruman explained to, and Dr. Lansky talked a little bit about how the logistics of the hospital are a little bit different right now, because you said there are asymptomatic people, and this is where the masks are so important. There could be someone that has COVID-19, they don't know they have it, and maybe 2 or 3 people around them don't know they have it, but they're giving it to somebody else. That's why this is so important. When someone goes to the hospital right now, what is the layout and what is different from what it was 4 months ago?
So there's very restricted entrances for the hospital. So we have a restricted entrance that's just for staff. All those staff employees are made sure they're screened, they're asked questions, their temperature is taken, they're reviewed on a daily basis anytime they enter the building. There's a restricted entrance for all other patients. Same also, they're going to get questioned. They're going to ask to be washed, to cleanse their hands with the antiseptic, and they're going to have their temperature taken. So everybody is screened prior to coming in. And even if you're coming in, if there's a line to come in, make sure there's a 6-foot space between you. So security's out there to kind of manage any kind of flow control. We haven't found it to be an issue. I think most people have been very, very cooperative, and it seems to be working well for us.
You know why? Because we're in El Paso. There's something special about El Paso. There really is. I mean, again, today we came in and just the spikes around the country too. I think there's not a compliance, but there's a humane understanding with caring for each other in this town. I love this city. Dr. Lansky, if you can talk about, let's get directly to some emergencies that you have seen, even though it's COVID time, but people are still bringing in someone who, and again, you're a pediatric emergency doc. What have you seen in the last couple of months that people are being brought into the emergency room for?
So coming out of winter, we are still seeing kids with fever, and certainly older kids that have fever. It's not uncommon, and they may have fever for a day or two, but otherwise look well. And those kids we may be less concerned about, assuming they don't have any other underlying medical condition.
Right.
But young infants with fever is a very different situation, especially infants that are only a few months or less of age. And we have seen a little bit of a delay with some of those patients, which can make a critical difference, especially in a very, very young infant. So we're still seeing that. We're still seeing some, or we were seeing some asthma still come in. We're certainly seeing a lot of abdominal pain, and we've had some acute appendicitis. So even though COVID's here, there are other diseases that are still prevalent, and we're still seeing.
So the message here is COVID is here, yes, but as we were talking, the hospital is prepared. The hospitals are prepared. Everyone's trained. This is something that you don't want to just sit at home with and hope it passes. That's really the message here this evening. Yes, we understand that we are in this time and day, but at the same time, you don't want to take your life at risk. Dr. Bruman, let's talk a little bit about heart attacks and strokes. I feel like those
Exactly.
I'm thinking about the things that are so timely that if you miss an hour or 2 or 3, it really matters in the outcome. Take whichever one you would like to take. Heart attacks,
I'll
let's do
start
that
off
one
with
first.
stroke right
okay,
off the
start off with
bat.
stroke. Okay.
Because stroke is one of those diseases where if you have it, you're losing 1 million neurologic component type cells, not strictly neurons, but glia and everything else within a minute. So every minute you delay that, you're losing 1 million cells. This is a very time sensitive issue. We already had a problem with El Paso of not coming in a timely basis or driving themselves in. This has gotten worse. We only have 3 hours in which 4.5 hours to give you this clot busting drug. We only have 24 hours to pull out a clot. That doesn't give us a lot of time. In 24 hours, if you're waiting that long, you've lost a lot of neurons already and a lot of mental capacity. That's my biggest scare right there. Number 2 is chest pain. People with all kinds of chest pain we have seen just delaying, and either they have a heart attack or they're coming in with heart failure days to weeks later because they've been so afraid to come in.
Yeah.
Again, these are diseases where they are very time sensitive. I wouldn't put away a belly pain. I mean, we have seen people come in with delayed appendicitis. So now they have a big phlegmon, which is something that's going to cause a big change in the way they were treated. Generally, if you come in with simple appendicitis, you can get a laparoscopic surgery and be out the next day. If you're going to have an open procedure, that's a whole different deal. That's old school. That's what we used to practice, 30 years ago.
Right.
So all of those disease processes are really important. Shortness of breath. If you're short of breath, you know something's wrong, you need to be seen. So I think all of those things really are very time sensitive and need to be evaluated rapidly.
And again, when people do come into the ER, the people that are already there that are suspicious of COVID symptoms, they are in a separate place. And again, I just want to repeat that so many times so that if there is anyone that has a fear of going and they do have an emergency, that has already been talked about with the staff and has already been addressed.
And the
yes.
staff is very well educated on how to, we don't want to get sick any more than anybody else.
Yeah, exactly.
So we're using a lot of precautions. We don't want to spread the disease from one place to the other. The nurses and the rest of the staff members are very well educated on how to prevent that spread from one person to the next. So it is a safe place, and it is safe not only for the patients that are coming in, but for our employees.
And that makes a big difference too, because everybody wants to make sure that I'm doing good too. And also we would know and have heard about it on the news and everywhere else where these things are reported, that if medical staff were coming down right and left with illness, then that would be an issue. And that is not the issue. So that's something, again, that we want to stress.
I will bring up that
Yes,
the
Dr.
one
Lansky?
piece of news that we brought up was 100% of the people are now washing their hands.
There's
So
thing.
it was about 97% before this. Now it's 100%. So everybody's being very good about it.
You know what, for us moms, it's lovely to see our kids washing up. It is. It's a small little, got it. Good job, good job. Dr. Lansky, let's talk about what you are seeing with parents bringing their kids in. What is, and kind of like what Dr. Bruman was talking about, is the idea of, oh gosh, what do we do differently now? Is there a hesitancy that you have seen? And if so, can you speak to that and maybe speak as to what you do see and what you would like to see instead of? Does that make sense?
Yes,
Okay.
so there absolutely is a hesitancy, and we've certainly been seeing that just by our average daily census, if you will, the number of patients that are actually coming into the emergency department. So we're seeing far fewer patients right now than we would typically see this time of year for fear of catching something. And so from that standpoint, again, it's really important to push home the point that if your child is having difficulty breathing, if your child is having persistent vomiting or diarrhea, especially as the weather's changing, it's becoming so hot, not to delay if you have a genuine concern. We are taking the measures to make sure that we keep the kids safe. And even though what we're learning with COVID, yes, we can see some sick children with COVID itself. For the most part, it seems as if many of the children are either asymptomatic or just mildly symptomatic.
Right.
And yes, there have been reports of a specific syndrome and some other things that are associated with COVID, but when you look at overall numbers, those are very rare occurrences. And so, although the kids seem to be spared more of the severe illness, although it can occur, again, these other illnesses, we want to be able to see. And as we head into summer, I had a child that was delayed coming in with a broken arm, unfortunately. And again, it was minor. The child was fine. We took care of them. Everything was fine. But again, we do want to allay parents' fears that if they have a genuine concern, don't hesitate to come in. And if nothing else, get on the phone to your doctor and get advice from your child's primary doctor as well.
Exactly. Nicely said. And Dr. Berumen, let's talk about, Dr. Lansky had mentioned that it's summer, and there's a lot of specific things, heat strokes, things in the summer that emergency rooms see a lot of. What are some of those? And if there is anything that some of our audience says, oh yeah, well this and that and the other, I am going to go to the emergency room. So summer does, sorry, it's hard to talk this. It presents its own list of things to come see the doctor for.
Sure, we see a lot of heat exhaustion. Certainly anybody that's working out in their little COVID projects around their houses and aren't hydrating up well, that's probably number one. And then exposure to the sun, sunburns, thermal burns from touching hot metal objects, leaving your kids in the cars, that kind of stuff. Stuff that just comes up over and over again. Those are the issues that we see over and over again. Then we'll come into West Nile virus season and equine virus season. So that's just right around the corner now too. So these are all diseases that we're very used to seeing and treating, but we need to see you. We cannot treat them just by the phone.
And since you mentioned it, again, symptoms for West Nile are?
Well, generally
like flu, right?
they can vary.
Yeah.
Okay, they can vary much from a flu-like illness to meningitis and seizures, encephalitis. So it really varies on the disease process. But those diseases are common to this area every summertime, and we expect to see them again.
Right. I am not being a rude teenager, although it seems like I am. I am getting questions from the audience on my phone via text. So one of them is here, and this is one that we've heard a lot, and I don't know if there is a real easy answer for this, but Dr. Lansky, this is not pediatric in any way, but it's just your term, so there you go. How can you tell if I have COVID or the flu? When do I know when I really need to go in? And that's a question you've probably heard so many times, and there's not like a real answer, and you're welcome to pop in your opinion on this too. But what are you telling patients or just people in general when you're speaking that when is it time to go in if they're suspecting either COVID or flu?
Sure. So this is certainly a common issue that we were facing at the beginning of spring, and we're anticipating that we're going to face this again late fall into winter.
Right.
And the symptoms of COVID and flu overlap greatly. And so a person may not know what one would be like as opposed to another because there is so much overlap.
Right.
But it's always the same recommendations we make. If you're having difficulty breathing,
Right.
if you are so dizzy that you're unable to walk well, if you have persistent vomiting, severe abdominal pain, any of these things would be considered potentially and likely emergent conditions that need evaluation.
Right.
And so if you have a fever, you're not feeling 100%, you take some Tylenol, you feel a little better afterwards, then it comes back again, that type of an issue you can write out a little bit and see what happens. But any of these other things that I had mentioned previously, we would certainly want to see someone for. And with that said, and we encounter this so much in the emergency department, we call it progression of illness or progression of disease. So early on in an illness, someone may look just fine.
Right.
And it could be 12, 24, 36 hours later that things have really changed. And so even though you may be feeling all right one day, the next day, if some of these other things are cropping up, again, it's time to get looked at.
Time to get looked at, exactly. There's something here too. Prior to the show, I was visiting with some folks from the hospital, and Dr. Baruman, if you can talk about this, earlier there were not any not visitors, but an accompanying person allowed with you into the ER. Now that is allowed up to one person, is that correct?
That is correct.
And if you can explain before and why yes now, and what the parameters are around that one person joining the patient.
So as we learn more and more about the disease, we're going to see changes go along. Certainly this was a component that we still screen every single visitor that's going to come in there with it. Not everybody is encouraged to have a visitor, but sometimes the elderly patients, those with difficulties communicating, patients that have had strokes and can't really communicate well, these patients, they're relying on their family member or their caregiver to give us the history, to give us what's been going on in the last 12 to 24 hours. So we found that to be essential, especially in either the very young, the very old, or those that have a communication problem. So it's been very useful to us. You won't be able to switch visitors, but we come in, the visitors are still screened, they're still questioned. Any questions about them possibly having the disease, they're screened out and they won't be able to come in. But we have found it very valuable. It helps also allay the fears of the patient, knowing that they have a family member there. It's if you get put in a PUI room and suddenly everybody's coming in you with masks and gloves and everything else, or you see that PUI patient going in there into that place and you're just the visiting patient or the other patient, it's kind of scary. We know what we're doing. We're not going to kit you, we're not going to put you or your visitor in that kind of situation. Those patients are separated out.
So on that note, while we're talking about going to the hospital, if somebody feels like, you know what, this is going to be something that's serious enough for me to actually stay there, I just have this here as one of my questions, what should they bring with them? Because again, the idea of leaving the hospital, coming back in, leaving the hospital, coming back in, that's not really going to be an option. So should they bring, phone charger, toiletries, if you feel like, again, stroke, heart attack, or if it's something that's serious enough that you think I'm probably going to be admitted, it'd be better to bring what with you so you don't have to send somebody home to get things from home.
So certainly I think anything that's going to help you with communication. So your phone charger, your phone, if you use FaceTime or iPad or something like that. Toiletries, we have toiletries available. We used to call it the positive suitcase sign. You always knew the person that wanted to be admitted because they come in with all their stuff. If you know that you're going to be staying for something, you look like you're going to have a surgical procedure, something like that, that's great. Oftentimes the stuff at emergencies are emergencies and you don't plan ahead. But definitely your phone or some kind of communication device and some kind of way to charge it.
Right, that makes perfect sense. I'm going to throw this out too, and then we can talk about it at the end of the show as well. But the Hospitals of Providence has an online registration tool that's available to register and reserve an ER appointment. And that may be, and Dr. Lansky, again, it's just your turn again. As you said, sometimes you don't know when emergency is coming and you just got to get there. But if you have a little bit of time, say a broken arm, or say, his ankle really looks like maybe it's broken, maybe it's not. There is a website, erasap.com, where you can make an appointment. Is there anything that, I'm not familiar with that. That was the first time I heard of it today. If you'd like to talk to the audience a little bit about that.
Sure. So it is a way that if you know you're coming into the ER with a specific condition, you can get online and you can reserve a time, if you will. The issue, of course, being an emergency department and not a physician's office, is that anything can happen at any given moment.
Right.
And things can change minute to minute. And so we always ask, if people are using this tool, just to be cognizant that we may not have a room immediately available, although we make every effort to have one. It also does allow us to know what what may be coming in. So, oh, this person has a broken arm, good. You know what, we're gonna need one of these 2 rooms. We know what we're gonna need, and so that can be helpful that way. But again, we just wanna caution people that even though, you know, the tool's available and is certainly available for use, it may, you know, depending on what's going on at that moment,
Right,
when they arrive in
right.
the ER, there still may be a little bit of a delay if there's not a specific room available at that time.
Exactly. So again, I'll give that out. It's ER, just like emergency room, and then ASAP, as soon as possible, .com. So ERASAP.com, again, with the understanding, as you said, and we'll stress it because we don't want anybody to go in and think, well, I was assured this time. It's an extra layer of, well, maybe I'll get in there and get seen, and yes, there is an extra layer there, but if somebody comes in, again, big car accident, et cetera, that is something that we'll have to kind of pull back on that. Let's talk to Dr. Berumen. Am I saying it right, by the way?
Berumen.
Berumen. He was saying, if you say it like the Spanish, and I said, well, you say it like the Northern European, you do the rrr in there. Talk about some of the cases that have been not COVID related, that you have seen now at a little bit of a later stage. You talked a little bit about one earlier, but I want to get across to the audience that if you're seeing this, don't wait an extra day or 2 days or 3 days. And you've seen several of these, as I understand, over the
Correct.
last 3 months. Give us some case studies, no names or anything, but give us some case studies of when a situation would have been so much better if you had seen them a couple of days earlier, if there wasn't that fear of going to the emergency room.
So I'll give you 2 perfect cases. One was a very dense stroke where this person had a clot. And with a clot stroke, we have up to 24 hours in which to get that clot out of there. We can still save brain tissue, even though you've lost a significant amount. That person showed up 48 hours into their disease process.
Okay.
Essentially then, all I have to do is rehab you. You're left paralyzed on one side of your body. This person could no longer speak very well, and they were left with what's called a dense hemiplegia, meaning unable to move that right side of their body. If they would have come in within that first 24 hours, there's no guarantee that we would have got it all back, but we certainly could have intervened and taken that clot out and saved a significant amount of brain tissue and maybe saved a significant amount of function for that person. So those are one of those very, very sad cases where you see. The second one I'll tell you is actually somebody who would probably have had a heart attack, we think, came in with congestive heart failure about a week later. So they had had chest pain, severe chest pain, shortness of breath, and they were afraid to come in. They were afraid to come in because maybe I have COVID. That didn't make sense. But people don't make sense at times when they're scared.
Yeah, exactly. Fear is a motivator that's not always a good one.
Correct. So they didn't come in, and then a week later they're coming in with very swollen legs. They can't breathe. Their heart's a mess. That is another organ where if you damage it, it doesn't repair itself. So those are the 2 cases that stick out very well in my mind. And the person with the heart attack was a young person in their 50s.
Oh, goodness.
So now they're left as a cardiac cripple because their heart failure is so bad. So those are the things that you really need to focus on.
Right. Let's go back to the ABCs of a stroke. And it seems like we talk about it all the time on this program, but if you're looking, what are you looking for in a stroke? And often with a stroke, you see it happening to the person you're with, because sometimes you don't realize it's happening yourself. You notice something on somebody else. So let's go through some of those symptoms again.
I think the big thing to remember is fast. So it's face, is it facial asymmetry? Does he have, facial droop? Arm weakness or leg weakness is the A. So any kind of weakness on one part of the extremity or the other, so on the same side especially, so you have arm or leg weakness, that's good. Smile. Do they have a crooked smile? Is something wrong, or their speech is wrong? So S is for smile and speech. If there's something wrong with the speech, garbled speech, or they can't get their words out, that's another one. And the T is, that means time to call 911. So any of those things, the facial asymmetry, problems with your speech, problems with your smile, which is facial asymmetry, weakness on one side of your body, call 911.
Okay. You talked about heat exhaustion earlier, and then there's heat stroke. When there's heat stroke, when it's something that's caused by heat, are you still looking at the same symptoms that you just described for a heat stroke?
Now, heat stroke is something completely different.
Okay, let's talk about that, because that's what I thought too. So let's talk about a
Right,
heat
so-
stroke. Somebody out in their yard all day long, building that extra house back there for grandma. So now it's 5 in the afternoon, heat stroke happens.
Yeah, so
What are you looking for?
so heat stroke essentially is lost the ability to cool yourself down. You're no longer sweating. So at heat exhaustion, you're still nauseated, you're still sweating. At heat stroke, you no longer you have the ability to cool yourself down. So you've stopped sweating. So stroke in that case is not what you think of classically as weakness on one side of the body or not. It's the inability to cool your body down. Your brain doesn't tolerate high heat. Most of your tissues don't tolerate high heat, and certainly the dehydration, your kidneys don't like that. So that's the difference between heat exhaustion and heat stroke. Heat stroke is truly a medical emergency. Heat exhaustion is nothing to laugh at either. It's something that needs to be addressed.
Okay. Nicely said. I'm getting here questions again from the audience, and this is a good question, Dr. Lansky. Again, not pediatric, but question is a colonoscopy, if I'm in a high-risk group, considered an elective procedure? So, and maybe let's talk a little bit about that. I don't want to pinpoint you on an idea. Mammograms, for example, are elected unless it's a diagnostic mammogram, I would think. Colonoscopy, unless you think that there's something going on, then maybe go and call. What are the hospitals doing right now in procedures like screenings that might just not be regular screenings, but could be a diagnostic screening?
So, not being an expert in any of these
Right.
specific disciplines,
Right.
there is a stratification. Things that are considered elective, which may be I have a bad hip, but I've had a bad hip for 3 years,
Right.
and I could live with it right now. And so not something that's necessarily emergent, or it may not even be a very, very urgent. If you're in a high-risk group and you're at and you're past due for a screening, that may be pushed up a level, but that would be something that specialist, whether it would be a gynecologist, whether it be a gastroenterologist, a cardiologist, they would be able to tell you where you fit within that continuum, and whether, we need to do this within the next week or month, or
Right.
no, we've got six months, let's let things cool off a little bit more. And so the hospital is working with the specialists to be able to take care of the emergencies, of course, like appendicitis or like a stroke or like a heart attack, but also to be able to work in patients that would be considered urgencies.
Right.
And that time is ticking, and we do need to look at these things sooner rather than later.
Right.
The best source of information is going to be that specialist, and discussing with them and seeing where you fit in the continuum and what that means in terms of when you'd be able to get that procedure.
So I'm going to, and I do this often on this program, I talk about me because I feel like, we're all human beings here. I had a mammogram back in September, but there is a suspicious dimple that I have on one of my breasts, and I thought, well, it's time of COVID, what do I do? So I called my doctor, and they said, you know what, if you're suspicious about it, I've had some issues before, she said, let's go get it done. So I do have an appointment next week to go in. Yes, the place that I'm going to, the screening place, they're only allowing 2 days a week. Everything is very safe. They have called me, they have told me what the procedures are of how I'm coming in. They've asked me questions if I've been out of the country, have I been out of the city, have I been out of or in touch with anybody. So please know that if there is a procedure that you really need to have done, or if there's something that is wrong, don't put it off. Definitely call your doctor first, or call the hospital, or get there. They are in a position to be safe, to keep you safe, and to keep themselves safe, which is a beautiful way of saying it. You don't want to go to the hospital, you're there every day. You don't want to get sick, you don't want everybody else to get sick either. That's the point of today's show. That yes, this is very serious. COVID is absolutely something to look out for, but there are other underlying issues that many people have. Those need to be taken care of. So important. I'm getting dinged on my phone, so that means there is another question here. Patient has strep throat and has recovered, but is also now showing signs of fever, and wants to know if this is something that they should go to the doctor about. Maybe we should talk here about some of the testing sites. And whoever wants to take that, just nod at me or wink at me or wave or something. Dr. Bruman, you smiled big with those eyes, so you get to have this one. Bruman. The testing sites, my son had a fever. He's a strep throat carrier. he got the strep throat test, the regular flu test, and the COVID test, and this was maybe 2.5 months ago. Is that what's happening at all sites? And maybe we can talk about, even though that's not part of the show, but just because there's a lot of curiosity out there as we're getting from the audience, what is it that the test sites are testing for and access, et cetera?
So the test
Feel free to
sites
jump in.
are still testing for predominantly COVID. The influenza season is pretty much done, and so we haven't seen influenza, and so that won't be tested. Now, if you have a specific disease process like strep throat, then that may be tested. I don't know that they're doing it at the testing sites. The issue is if you've had a disease process and it's been treated and you have something come back, I don't care what it is, it's time to discuss it with your physician. Now, is it something that you need to come in and get tested again for? Is it something that we need to get you one of the testing sites around the city? The city has multiple places that can be tested. It goes up, if you go to EP Strong, it tells you all the different sites and all the different locations that are available. I will tell you, the issue now is, as everywhere else, it's going to be swabs and reagent. So when we get short on that, then the times to get the results back may be delayed. But that's a nationwide situation.
Right. And the time it took for his test to get back were about 4 days. So, and that I thought was a little quicker than I expected.
I'd like to mention
Yes,
one thing
please, by all
about
means.
testing in general.
Yes.
And it's actually a little bit different than the flu because we actually have a medication for the flu that we will give if patients qualify for that. In terms of COVID, there is no treatment.
Right.
And so if one has a fever and isn't feeling real well, is it 100% necessary to run to get tested? Not necessarily. Now, there are a few caveats to that. Does the person have an underlying medical condition? Is the person in contact, maybe a household contact, with someone that has an underlying medical condition, or who is at an extreme of age that would be more susceptible and likely to have more complications if they contracted COVID. And so there may be reasons to test, but because unfortunately availability of test kits still is better than it was, but
Right.
it's still limited to a degree. Not everyone necessarily needs to be tested, but we do have the test sites, and really, as long as people qualify at the test sites, there's no restrictions. You can go and get tested.
Right.
You know, if you have a fever, if you have respiratory symptoms, if you're worried about that.
And El Paso really jumped on the ball with that too, which was really great. On that note too, I have a couple of questions here regarding vaccines. One of them is the flu vaccine that we get every year anyway. And this is something that we can't really see into the future, but maybe you guys have seen some research or what have you. The flu vaccine that is given every year, is that something that we should do again come end of summer, beginning of the fall? And is that going to be effective, and or is it safe to take that with also knowing that COVID's around? That's like a multitude of questions in there. So maybe read my mind and read what this person might be asking. And Dr. Bruman, I know again, we're in summer, so it's not in that season anyway. The next flu vaccine probably isn't quite developed anyway, because I guess it usually gets put out in the
we get it from
September
the
or so.
we get it from the opposite hemisphere. So essentially, what Australia gets, that's what we think is going to hit us.
Gotcha.
So that's generally how we develop the flu vaccine. Will it be effective? That's the question every single year, and it's a lucky shot if we get it. Most of the times we do, but there can be changes in it. It
Right.
mutates. So for the most part, yes. If you're susceptible, if you have a high-risk diseases and your physician tells you should be getting the flu shot every year, absolutely get it. I think that's the best thing to do.
Okay. Yes, Dr. Lansky?
And I think as we get into the upcoming flu season in once summer ends, if in fact we have a resurgence of COVID, it'll be really, really important for people to be protected from the flu.
Right,
It'll be one less thing to worry about.
exactly.
One thing I always tell parents when they ask me about the flu vaccine, I heard last year's vaccine didn't work real well. What I explain to them is I've been having the flu vaccine for over 20 years being in medicine. I see, I don't know how many hundreds of kids during flu season with the flu. And I cannot recall having the flu myself in years. The last time I remember I was in training. The vaccine is really cleaned up. it's not a live virus. These are virus particles, if you will. And it basically fools the body into thinking that you have the illness, and thus you develop the antibodies, and these antibodies hang around, and there's some immune memory. And so if you get the vaccine year after year, if there's a year that the strain mutated and we didn't catch it, you might have some partial protection because of the years previous that you've received the vaccine. And so I'm a big proponent of get the flu vaccine every year. Side effects really are quite low, and people seem to do very well with it. And it really can prevent a significant illness.
I love immune memory, what you were saying, because that does, I am too. I am that person around the office. Hey, did you get your flu shot? And I think so too. I think that should be done regardless going through. And yes, it's going to mutate. The COVID right now is mutating a little bit. So it's going to be, I will address it here. I know it's kind of a weird way of buried into this question, but the effectiveness of whatever the COVID vaccine will be, bottom line is we don't know yet.
We don't know.
There are so many, I understand that, every country is developing. Germany's testing or developing one. America, I think, is doing 4 of them. Australia's doing one. So all around the world, there are vaccines that are trying to be made, so to speak. Is the first generation going to be great, perfect? No, probably not. And that's just one of those things. It is an evolving science. I just wanted to address that since that was here. Question here, let's address this immediately. Will antibiotics work for COVID? No. And this is something that I heard from someone else several weeks ago too. It's like, oh, I've got my Z-Pack or whatever. Describe so maybe really quick, we are actually good on time. Describe what bacteria infection is and viral infection is. I think that's so important because people think, oh, an antibiotic can knock this out. This is a virus. Antibiotics are for bacteria. Who wants to take that one on? I know with kids, parents say all the time, right? Just give them some antibiotics. So you know what, Dr. Lansky, you get this one first. I'm sure you do.
So we have viruses, one type of organism, and viruses require what's called a host cell. In other words, one of our cells in our body to be able to make more viruses. Basically, a virus takes over a cell in our body and uses that cell to manufacture more viruses. Bacteria, different type of an organism, replicates itself, and we have antibiotics that work against bacteria. So our amoxicillin and augmentin and Z-Paks, those are for the bacterial illnesses. And there are antivirals out there. They're not generally used on a routine basis. A lot of it has to do with that viruses mutate so quickly. The common cold is a perfect example. We've never figured out a good treatment for the common cold. I tell families all the time, whoever develops a great treatment for the common cold is going to, be set for life because everyone's going to want it. But for an illness like the flu, we do have antivirals. They're only partially effective, but again, for high-risk individuals, they can be very helpful. And there are other antivirals for other illnesses. HIV, there's antivirals for that. But for viral illnesses, for colds, for some gastroenterologic illnesses, some types of vomiting and diarrhea, those types of things, oftentimes that can be viral, and we don't have good medicine for that. Our bodies, thankfully, will take care of it given time.
Nice. And that's a beautiful thing. And time sometimes is like, oh my gosh, how much time is this going to be? I have a question here from the audience. Again, it's something that I don't think we have a great answer for. And then after this question, I want to get back to some more ER questions. But kids going into school, and Dr. Lansky, I know you were just talking, but you're the peds guy. Thoughts about upcoming school season and social distancing and younger kids. And so maybe this person's talking about, somebody of the high school and middle school age, they understand, they get it, they may not follow it, but they kind of get what's going on. But say someone who is kindergarten, first, second grade, going back to school, are hospitals talking about it, or doctors talking about that in general? And I know we're 2 months away from that, so it seems like an eternity, but it's also tomorrow at the same time. What are you hearing in the medical field about what will be coming up in the fall and school starting again?
I think this is a real tough one.
It is. And
it's-
I feel almost guilty about saying
No,
it
no,
to you.
not at all. And it's something that I've given a lot of thought in, because I'm involved with a private school in the city, and I'm involved with some of the policies we're setting, et cetera.
Okay.
So we've been talking about this a lot. But what makes it very difficult is what we're seeing that occurred this spring with schools and home learning, internet learning. They're already looking at how effective was it. And they're finding often with the younger kids, it wasn't as effective as they had hoped. Now, of course, this is brand new. We threw
Right,
the
we don't know.
educators into this.
Exactly. And again, there is a disclaimer at the beginning of the show, so know that we don't know
for sure.
everything.
And they're
Right.
gonna and they're gonna learn more effective ways. But I think the general principles are going to be with older kids, and exactly what age that is, of course, it's going to be child dependent, but probably kindergarten, first grade is probably where we're going to be able to have kids wearing masks. And so this may be, we talk about the new normal a lot, but this may be a temporary new normal that we'll have kids at school with masks. Maybe not when they're outside running around when it's hot, we're not going to do that, but inside. Classrooms, are we going to have half the size of classrooms with spaces in between, an
Right.
empty desk in between each child? Does that mean that now kids will be going to school a few days a week and home a few days a week? There's a lot of murmurings of that within the educational community. So I think people are still trying to work that out. Again, the good news with kids is they seem to do well with the illness,
Right.
but we don't want them to get it, obviously.
Exactly. And again, the spread. You were
Right.
talking about asymptomatic. You don't
Right.
want them to give it to somebody
Exactly.
else, not knowing that that is happening.
So I think it's really balancing what the kids need from a socialization, educational perspective, and what's going to be safe. And I think a lot of I've heard murmurings of a lot of it's going to be pretty standard practice taking temperatures before you walk in the building, perhaps masks, a lot more cleaning, a lot more
Right.
hand washing, being more cognizant of how far spaced our desks are.
Exactly.
And I don't know that anyone has the exact answer, and I think, unfortunately, just like everything's been with COVID right now, what we knew 3 or 4 months ago, and what we
So much
learn now is light years, and
Yeah.
and there's still so much we don't know, that's continuing. And so I think, I believe that the schools are going to take the advice that the medical community is giving them and come up with a plan, and hopefully that initial plan will work well for the kids.
Right.
But I think it really,
Yeah, there's a
We'll
lot to
see.
be decided and see out there,
Right.
absolutely. We are at the 10-minute mark before the show ends, so what I want to do is get back to, really quickly, give out the website once again, that if you want to try to make an appointment at the ER, also understanding that if something big happens and you do have to wait, at least just something that kind of gives you a placeholder, so to speak. But it's ERASAP.com. So ER like emergency room, and ASAP as soon as possible.com. And then also just questions that you may have in general about emergency procedures and just how the hospitals of Providence are running things right now during COVID and just all kinds of things. The hospitalsatprovidence.com is a website to go to. And again, they are our underwriters this evening, but just spell out thehospitalsatprovidence.com, and that's where you can go to get all kinds of information on if somebody has a heart attack, somebody has a stroke, what are the procedures of getting into the emergency room, where, what side of town, etc. On that note, Dr. Baruman, we're probably a good 9 minutes out now. Is there anything that we haven't talked about that you really want to get across tonight, or just something that you'd like to reiterate that we've talked about earlier?
I think we've left out our EMS colleagues.
Oh, yes.
The EMS department, I'm actually EMS medical director for the city of El Paso. These guys do excellent work. They have PPE. They will go into your house with PPE. They practice well. They keep their rigs very clean. So after they've transported a patient, they will clean down their machines. Before they transport a patient in that they suspect is a PUI or somebody who may have COVID exposure, they'll let the EMS, they'll call through their EMS radio and let the hospitals know. That way the hospitals can prepare and make that corridor for that patient. So the EMS system is also extremely safe. That's the system you use for a stroke and a heart attack. Those guys will take good care of you. They do good assessments. They use PPE, and they clean down their rigs rigorously. So our EMS colleagues really deserve a lot of credit and exposing themselves day in and day out, trying to save our lives.
Exactly. And shout out again, even without COVID, 3, 4, 5 years ago, we've always said on this program, if you have a question, don't drive to the hospital, don't just call 911.
Right.
Get it done. Is that still what you're
That's
talking about
exactly
today?
right.
Excellent. Dr. Lansky, how about you? Anything that you'd like to further speak about tonight before we start asking a couple more questions here from the audience?
I think we've touched on much of it. Again, we're keeping the ERs as safe as possible, and if you have an emergency, don't hesitate to come in. And a plug for summer weather. You know, kids outside, kids are horrible at telling us when they're not feeling well.
So true.
Frequent water breaks, try to keep the kids in during the hottest portions of the day, let them go out briefly, you know, during the day, and hats and sunscreen are our usual summer recommendations.
Right, and there are some sunburns that are third-degree burns. Is that correct?
They got up to severe second degree.
Severe second degree. Yeah, I've seen some doozies in my time. But again, we just want to talk about the hospitals at providence.com. That again is the website to talk to, or to look up. We appreciate your patience this evening because this is all kind of new for us. First time I'm doing the questions via text and through this computer. I do want to let you know that if you missed part of this program and looking for some information, you can always go to the website for PBS El Paso, which is pbselpaso.org. And you can find this show and all the other shows that we've done before as well. You can also find the last COVID show that we did, which was March 12th. It's the only one that we've done other than this one. And there will be a little bit, as we were talking about, some information that is switched a little bit or just kind of done the teeter saw a little bit on that. Also, El Paso County Medical Society, which is the society that brings this show to you each and every month. Their website is epcms.com. So their .com, El Paso, PBS El Paso is .org to see this again. And the reason I'm saying that is that there are so many questions that go by and you don't get a chance to see them all. Going back to some of the other I just messed myself up. Again, thank you for your patience. Dr. Lansky, I wanted to ask you just specifically, as parents, because sometimes the mom and the dad and or the grandmother, whoever's taking care of the children, and that's something too that in this time, everybody that's a frontline worker who has children, and businesses are not necessarily all open, we're looking at daycares. So the idea that you were just talking about with schools reopening, what does that look like? Daycares are open, some of them are. And have you seen any differences in how daycares are run now compared to 3 or 4 months ago? And I'm asking this as a pediatric doc, and if anything more has come from children being in daycares versus children who are not in daycares.
I don't have real close experience with the daycare, so I will preface this by saying that. I've heard through the grapevine that, again, the daycares are just being a bit more cautious with regard to temperatures, with regard to cleaning afterwards, although generally do a very good job cleaning, but we're talking about more COVID-specific cleaning, which the products are a little bit different. So that's my understanding.
Okay.
The fact that the rates of significant COVID illness in children is so low. I personally have not seen a big difference with people that I know have kids in daycare and not.
Right.
And again, it's a fortunate situation with children, and it's not to say that children can't get significant illness with COVID, but it's much less seen than what we're seeing with the adult population.
Yeah, and that brings me back, Dr. Bruman, to the asymptomatic, you know, and we're not going to test toddlers if there's not any symptoms there. But again, the idea of social distancing, that's something I want to get across this evening. Just about the news that's been going on throughout the day, through the last several weeks of us hitting our spike again, coming back down, what's going on. I would love for you just to give your public information message to the idea of social distancing, the idea of wearing masks. Again, prior to coming on the air today, we thought that we would not be wearing our masks, but then we saw the space and thought, well, it's a little smaller than we expected, let's do it. So anytime that sometimes it's a gut and a common sense thing. 6 feet away isn't that far if you're yelling and talking really loud.
Or if you sneeze.
Or if you sneeze. So go on that for the next minute or two.
I
what
think
you
the
think
key
about that.
is the key is essentially is masks. It's been shown over and over again. You're protecting other people. This will drive it down. Even if we have 60% of people wearing masks, it drives the disease process down. We have 95% of the people wearing masks, it's going to really drive it down. Wear your mask correctly. Don't have your nose sticking out. That doesn't do any good whatsoever.
Or pull it down to talk, like
right.
somebody did
Don't
earlier.
pull it down to talk. Be careful when you're wearing masks. The first thing you want to do is keep touching yourself. And that the more you touch yourself, the more risk you have of contaminating yourself. So use your mask correctly. Use hand sanitizer. Wash your hands frequently. Wash your hands correctly. It's not the 2-second wash, it's 20 seconds. So sing the birthday song. Whatever it needs to do to wash your hands correctly, cover all the surfaces. You're protecting not only yourself, but your family members and the rest of our community.
Exactly. And when washing hands, somebody said this to me too, think about under the fingernails, because when you're touching things at the grocery store, you're touching with your finger and it gets under your fingernails. So use that well if you can find one of those brushes. Doctor, I know really we're about to wrap up, but you talked about products like bleach and what else are specific to COVID versus, you're talking about daycares versus other cleaners.
Well, a lot of the products containing alcohol.
Okay.
And at least for hand sanitizers, it depends whether it's ethyl alcohol or other forms of alcohol. So
Right.
there are some issues with that, whether it's 60% or 70%. But it seems like a lot of those products, the virus, needs to be in contact with the virus for a lesser period of time than other products like a bleach that requires a lot longer period of time. So like in the hospital, we're not using bleach for cleaning,
Right.
we're using other products.
Okay.
And so that's what I was referring to.
No, that's good, because people, again, you go shopping and they're out of everything. You're like, really? Is that something here? I want to say thank you very much to both of our students. Hey, we did it. You guys, this is the first time we've done it. Way to go. So Jonathan Espinosa and Prakish Tomas, thank you very much for helping out. And again, that's Texas Tech Paulo Foster School of Medicine. And since you guys have come on board a couple of years ago, it's been fantastic. Again, to watch this show again, pbselpaso.org. or EPCMS, which is the El Paso County Medical Society.com. I'm Catherine Berg, and you've been watching the El Paso Physician.